Hi, I'm Joshua Gran. I work for People USA. We're a local mental health nonprofit agency.
And I'm Captain Filak with the Saugerties Police Department. I'm one of the instructors here at the CIT course, which we just ran at the Ulster County Law Enforcement Center in Boulevard in Kingston.
So CIT stands for Crisis Intervention Team, and it's a 40-hour training. And it's about teaching law enforcement, who are often first responders in crisis situations, how to better engage with people and de-escalate crisis situations. And those can be due to mental health, addiction issues, or some of the social or economic determinants of health. So we teach them how to better engage, de-escalate, how to link people to better and more appropriate services, how to divert people from the criminal justice system when community-based treatment is a more appropriate response, and how to improve the safety and effectiveness of those interactions, not only for the people that we serve as a community, but for the officers themselves.
We do devote a large segment of what we do here at CIT to officer wellness because we've come to find over time that we provide our officers with all the tools to go out and do everything they need to do on the job effectively. However, we fail to provide them the tools to take better care of themselves. So we do devote a large portion during one of the days to, basic officer wellness principles and how to recognize the signs of situational stressors, or the fact that one of your coworkers may be in crisis, how to reach out for help, how to connect them to services if it's needed.
And this isn't something that just began.
No,
when did this start?
Started this in 2015, I believe. Yeah. We're now running 2 classes a year, and we average between 25 and 30 officers per class. And we have this graduation ceremony because this is a big deal. When we graduate people from the CIT class, they have skills now that are over and above what the regular officer would have, and they have different expectations of how to handle people in crisis. And we think that's an important thing to recognize.
And how can you measure whether this is working?
Well, I'll tell you, there's a few ways you can measure it. One is how many people in crisis are diverted to treatment when that's an appropriate and more effective response. And the other thing is you'll see that officer injury and rate of use of force will go down.
I see. And do you do any follow-up with people that the police are engaging with to get feedback of how the situation was handled?
Well, one thing we do on Fridays, which is the last day of class obviously, is we bring in a consumer panel. And this consumer panel is comprised of people who either have mental health issues or had mental health issues, or are family members of people who've had mental health issues. And what they do is they provide some very valuable insight into how interactions with police officers have gone. What went well, what didn't go well. What things should you do as police officers to try to improve good outcomes with people that are dealing with crisis?
Now, with police brutality being such a hot topic right now, have things changed in a drastic way or a very noticeable way because of that, in terms of how you speak with your officers?
Oh, well, I'm not a police officer, but I can say that there has been far greater interest from far more police departments since the discussions about police reform and reinvention have begun, because a major component of that is improving engagement and de-escalation, and trying to use your mind and your verbal skills and your empathy as a tool for resolving any sort of situation that you find in the field, if it's possible.